right, good morning, everyone. Thank you so much for attending the webinar this morning. We are so pleased to present to you communication and leadership strategies to create a successful practice. We are really fortunate today to have really great guest speakers joining us for today's event, and I will go into introducing them very shortly. What we will do before that, though, is go through a couple of just a little housekeeping rules. So by now you should all be able to hear us talking. If you have any questions, please use the chat field as all participants will be muted. Please enter your questions into the chat field at any stage in the webinar. We will attempt to actually get to those as quickly as we possibly can. And if they suit the flow of the webinar, we'll actually answer them at that time. If not, we'll answer any questions afterwards at the end. And a link to the recording will actually be sent out early next week as well. So now, without further ado, I will introduce our guest speakers. We have Dr. Catherine Norton joining us today. She is a director at Norton Consulting Group. Dr. Catherine Norton has over 20 years experience working with business professionals across the healthcare industry. Dr. Norton has worked with the Australian Medical Association, the Australian Dental Association, the Royal Australian College of General Practice, and the Australian Association of Practice Managers. She has worked with all of these organizations at a national, state, and local level, and has written articles about practice management, teamwork, and leadership, created tools, checklists, and manuals, and developed strategic scorecards related to healthcare. Joining her will be Miss Anna Maria Gibb, who is the Senior Product Manager at PracticeHub. Anna Maria is the original co-creator of my practice manual, now called PracticeHub. She's passionate about helping healthcare organizations minimize their risk and run more efficiently using better business management systems and processes. Anna Maria has a background in practice management and qualifications in business and adult education. She regularly presents on business systems and processes. We're very fortunate to have both of you joining us today for the webinar. And without further ado, I might actually just hand over to Dr. Catherine Norton.
Okay, thanks very much for that great introduction. And we are going to kick off this webinar today. And thanks for all the chat comments that are coming through. We've got good morning from Brisbane, good morning, afternoon from Melbourne. So keep sending the greetings in and welcome. And we'll go to the next slide now and I'll just do an overview. We've really got the day divided into two parts, and the first part is going to be talking about leadership, communication and teamwork, and I'm going to be presenting some of my thoughts on that. And then the second half is going to be talking more about PracticeHub and how that ties into some of the leadership components that I will be highlighting for you. So it's a pretty exciting next few minutes, a half hour that we've got on sort of both leadership and management. Can I just say to you that my career has been a journey through the lens of my academic background from a communication research point of view. I've looked at many things in my career in terms of things like how to create a motivated workplace, how to get buy-in, even how to get high-performing teams in organizations. And I've looked deeply at the role of communication in things like patient satisfaction, doctor-patient communication, as well as internally among staff in a medical practice or in a healthcare environment, as well as organizations in the general business environment. And some of the tools that I've used have been organizational audits. I've done surveys, I've developed scorecards, measurement tools, and helped organizations develop strategy. So that's a little bit in more detail about my background. I've also worked with boards, councils at the highest level, large national hospitals, multi-specialty clinics in Australia, New Zealand, even in the Middle East, the United States, as well as working with practice staff. So what's been interesting to me in this career has been a recurring theme and a focus around leadership, communication, and teamwork. These three things are like three pillars, if you like, for what goes into making up a successful practice. So that's what we're going to spend a little bit of time talking about today. It's really just a conversation that will be the tip of the iceberg. And as we go through this today, I'd like you to think about how this relates to your organizational environment, your practice, your clinic, your hospital, whatever your environment is. And It also reminds me, in preparing this for today, the importance of the relationship between leadership and management. They really do go hand in hand, and you need both if you are going to have a successful organization. So working together, leadership is about the inspiring and the motivating, and the management is about the doing and the action. So we'll come full circle at the end of today and look at how PracticeHub can help you, in fact, be a better leader by offering really good ways and shortcuts to the management part of your running your organization. So let's go to the next slide. And I want to start out with a key question that I ask organizations. And I want you to think, as a practice manager, I want to ask you this question today. As a manager, just look at the first question. How does your boss know when you're doing a really good job? So just have a think about that for a minute. How does your boss know when you're doing a really good job? Some of you might be able to answer this exquisitely well, and that's terrific if you can. Others might not be able to answer it at all. They might just say, I don't really know. Or some of you might have some fuzzy guidelines about, well, we get the patients in and out on time, we get the bills paid, or things like this. So the question not only applies to how does your boss know when you're doing a really good job, but as a manager, how do you know when your team is doing a really good job? The same sort of things apply. And then also, as a manager, how do you know when you're doing a really good job? It's quite a thought-provoking question, and one that I've spent a lot of time, as I said, in organizations asking people to think about. And I don't just ask the manager to think about this question. I'll ask the CEO, for example, and say, as a CEO, how does your board know when you're doing a really good job? And I'll even go to the board and say to the board, as a board, how does your organization know when you're doing a really good job? So it's just a single question, but it's a very, very important question, I think, that goes to the heart of creating a successful organization. And in order to be able to answer this at any level, you need to have three things in place. The first thing you need to have in place is what constitutes a really good job. So first of all, you've got to know, what does that mean? What's involved in doing a really good job? Is it just financial? Is it about people? Is it about patients? What are the criteria that make up a really good job at all levels, whether you're working in a team, whether you're the manager, whether you're the CEO, whether you're on a board? So that's the starting point across the board. First of all, what constitutes a really good job? Then the next thing is, how is that going to be measured? So that's how are you going to measure? What are going to be the tools, the criteria that you use to measure whether you're doing a really good job? And the third one then is, how do you rate? How do you stack up against those criteria? So these three conditions, if you like, need to be present if you want to really understand how to drive success in your organization. And oftentimes they are left unspoken, or they're left fuzzy. And what I urge you to do is, don't leave them unspoken. Have the conversation, find out exactly how to answer these questions, and you're going to move yourself towards having a successful organization and being a stronger leader. Now, let's go to the next slide and have a look at the starting point. So you say, okay, that makes sense. How do we go about doing that? So I would urge you, as a starting point, to say, ask yourself, where are you going? I know it seems simple and straightforward, but it's absolutely critical. So leaders take you somewhere. We expect leaders to lead. So there's a destination involved. You're going somewhere. Well, where are we going? So leaders have to lead, and followers want to be taken. Followers want to go on the journey. So the leader and the follower have a synergistic relationship. Again, this is one that needs to be explicit and defined and talked about and communicated as you build your team. So you don't have people following some vague direction, or you don't have leaders with a group of people not really knowing where they're going. So this leadership and followership of critical aspects to taking your organization forward. So the next question then is, what are your aspirational goals? These aspirational goals are the meaningful goals that lead to greater engagement, performance, and satisfaction at work. They're what you aspire to be. It's a great concept, aspirational goals, and one that is worthy of spending some time really, really thinking about. And I like the quest metaphor a lot. You know, it's really a way to get at what are your aspirational goals. So what is your quest? Where are you going? Where are you taking people? What kind of workplace do you want to create? Because ultimately you can control your workplace. You can create an environment that is of your own choosing and depends on how you want to design it. And as a leader, it's your responsibility to do this. So it's what is your vision? And we know that vision and goals are inspiring. And if you can inspire people, you're going to help motivate them to achieve whatever the goals are and improve your performance overall. So in the next slide, let's take a look at some examples of a quest, just in general, just from history. So we've got the man on the moon, if you remember, was a quest of President Kennedy to have the first man land on the moon. And in that story, there was resources were put into it, energy and excitement, and they had a launch date, and the whole nation watched as this happened, and it created a tremendous amount of enthusiasm. Lots of other quests can be medical quests or sporting quests or journey quests or even mythical quests like King Arthur and the Knights of the Round Table. These are just some examples that are up there. One of our favorite quests is the Sydney to Hobart race. And that entails a whole lot of preparation and evaluation. So the idea of a quest entails a search. And it's something for which you give energy and you pursue it enthusiastically. And also the idea of a quest implies that you're tracking something, that you're following it, you're measuring it, you're looking at your performance. And also a quest, I think, implies that you learn along the way. So as you make mistakes, you uncover things, you make discoveries, you learn things, you refine your quest, you get it better and better until it's something that becomes achievable. So the next slide shows you that a quest begins with a question. And it's kind of interesting that the word question has quest as a core part of it. And in the beginning, the question might be a vague question like, what do I want? What kind of workplace do I want to create? What sort of practice? What kind of clinic do I want to create? And that is a really important starting point, and it might be quite vague. And then as you pursue your quest and you ask more detailed questions, it triggers other questions. So do you want to be the best in the world at what you do? Or do you want to just be the best in your local area? How you answer those questions starts to refine and define the quest. What kind of services do you want to provide? Do you want to provide everything? Do you want to focus on certain services? Do you want to emphasize technology? Do you want to emphasize research? How you answer these questions starts to give you the direction of where you want to go. And of course, there are going to be roadblocks in the quest. You might want to build a fabulous multi-specialty clinic in a great new location, and you might be stopped because there's building permits. So there are roadblocks that can stop you from achieving your vision and your dream. And so you have to work out, well, what do we do now? Where do we go from here? So a definition of a quest, something that we can start to work with, a worthy quest is purposeful activity, doggedly pursued to achieve an ambitious and doable objective. So this is the definition that I ask you to apply to your practices. So it's not just day-to-day running, it's activity that's purposeful. So you're doing it for a reason and you doggedly pursue it, meaning you go after it and you go after it and you have an ambitious objective, but it's not one that's impossible. It's one that you can achieve. So refining your quest is very important. All of these elements are important and all of them represent a stretch. So that's how you need to start to think about a quest. So in the next slide, you'll see the biggest payoff for a quest and this is so interesting, is powerful because it gives you a story to tell. So not only does it define what you're going to work on and what you're going to look like, but it gives you a story to tell. And a story is extremely powerful. A story organizes, it heals, and it energizes. So a story organizes meaning, and anything that organizes meaning helps us cope. So a story organizes things because it's got a beginning, a middle, and an end. It's got actors and it's got players, and we start to get to know the story, and it tells us, explains to us what's going on. And in the process of doing that, it's therapeutic because we get to know people more. We understand about ourselves as much as we do about the story of the quest. And also the story guides and inspires, so it energizes us. So when you create a quest, you give purpose to life and to your organization. So the story of a quest is actually, what's the purpose of your organization? And we can also apply that to our own personal lives. What is your personal quest? What is your purpose? And a lot of us are pursuing personal quests as well. So it's about finding a purpose and a reason. And the benefit for this is that people come to work knowing why they come to work each day. So it gives them a reason and a purpose to come to work that's beyond just getting a paycheck. Now, I'm not saying getting a paycheck is not important, because we know it's absolutely essential for living, but something more than that comes into play when you start to really focus on what is the quest. So in the next slide, there's just some examples that I looked at in preparing for our talk today about different quests. And these are from world famous medical clinics and hospitals. And you can see that they've got different vision statements there. I won't go through all of these, but you can just read them. But to get to this, what I did was I typed in the clinic hospital name and I typed the word vision after it. And so this automatically came up. This was the statement that came up in the search engine. So immediately the vision was outlined and defined. And I would ask you to go through this same exercise yourselves in your practices or clinics or organizations. Type in your organization name and put the word vision after it and see what comes up. I tried this for some clinics, and I found a recurring theme. They would talk about the profiles of the doctors or the expertise. They would talk about services that were offered, but they didn't all necessarily tell us what was the vision. And I think it's missing an opportunity to tell us what is the story of your organization. You can build it, you can create it. So don't leave it out. I'm sure it's there for all of your organizations, but don't underestimate the value of this for your staff, for your patients, and also for the wider community in motivating and inspiring people. So what is the compelling story that goes with your organization, and how do you get that out and how do you tell people? That becomes one of the challenges for all of your organizations. Okay, next slide, if we can. With this quest language, I just want to talk about this a little bit more, because we've, particularly in the last 12 months, we've seen this everywhere. With the quest for the vaccine. We're living the search right now, this sense of urgency, resources being put into something. It's at a global level, and we're all sitting with bated breath on what's going to happen, what's going to happen, what's the rollout going to be, how is it going to affect me? All of these things are at the forefront of our mind right now, but the quest language is firmly entrenched in our search for a vaccine at the moment. And you can see it's at a whole different levels. It's at a high level of the quest to find a vaccine, but it's at a personal level of a quest to, how do I get my own vaccine and what does that look like? And I know a lot of practices right this moment are dealing with this issue of, how do we get this service and this to our patients, and how do we communicate as fast as we can and responsibly and in a way that's going to preserve our relationship with them and keep them confident in what we're doing. So there's enormous challenges going on with this right now. So it's very, very timely. So in the next slide, I have a quest checklist. So you're saying, okay, that's all well and good, Catherine, but we are practical people here and running our practices and clinics. How do we do this? So 3 things are important. What do you want to do? Why do you want to do it? And how are you going to do it? So they're, if you like, the guiding questions in this journey. So I've chosen an aspirational goal as an example, and it's to create an energetic workplace. So you may or may not want to do that, but you should decide what is your aspirational goal or your series of aspirational goals that you would like to achieve. And you should go through this exercise of what do I want to do, why, and how am I going to do it? So the starting point is, what do you want to do? It's very difficult to do everything. So you need to prioritize, you need to sharpen and focus your vision and start to really hone that so you can identify what you want to do. Then you need to start to write it down so you're in a position to communicate. Why do you want to do it is important to understand what is the payoff for you. Is it important enough for you to give a lot of energy to this aspirational goal? And is it something that you're going to be able to achieve? Because you're going to ask everyone to come on this journey with you and help achieve it. So why do you want to do it is one. And you may even go through this exercise and decide, we really don't want to do it, and you have to change those goals. So it's important to do. And then the last one is, how are you going to do it? And this is, I would suggest, work backwards, work incrementally then towards that goal that you're trying to achieve. You think about the Sydney to Hobart yacht race. You go on that race, you have the end in mind. The Hobart is where you're headed. And to get there, you have to work backwards. What kind of equipment do we need? What kind of boat do we need? What sort of crew? What technology? How are we going to do it? How are we going to face these conditions? And you work backwards from that end to tell you how you're going to do it. All right, next slide. And you will see that we are talking about our focus. I said an aspirational goal, as an example, is creating an energetic workplace. And I've come up with 3 actions that I think contribute to an energetic workplace based on my talking with a range of businesses, as I mentioned at the outset here. So 3 things become important. First of all, a focus on well-being. Second, organizations foster authentic communication. And third, they maximize engagement. And as a manager, I would say with all of these, start with you. So you are a living example of how to embody these in your practice. And that's an important thing to keep in mind. Now what you have to do is start to define what these terms mean for you and what are the consequences of these things. So let's take a look at the next slide at well-being. And I've divided well-being into 2 areas. One is self-nurturing and one is organizational nurturing. So well-being is such a hugely important concept now and a way of thinking about our own health, I think. It's beyond the sort of diet and exercise that we used to look at. It's got many more components now. And I've just put some of these components up here in this slide, talking about our own personal well-being. And I talk about renewable energy because I like the renewable energy metaphor because it talks about sustainability. We have to be able to sustain our energy. And as all of us know, it goes up and down and depends on so many factors. So it's not a constant, it's not statically at one level. So when you're assessing your own energy and your own self-nurturing, you go through this process yourself. How much, what is my diet and exercise like? But other things like, am I drinking enough water each day? And these things are increasingly important. Sleep, we know now that sleep is not just a waste of time or something we do at the end of the day to get ready for the next day, that it's actually really nurturing us, and we need restorative sleep if we're going to organize our memories and get renewed. And so there's a lot of research there. Self-identity, how we feel about ourselves is important. We all know if we're feeling negative towards ourselves, it's going to show in things that we do at the workplace. Mental stimulation is important. How challenging is what we're doing? The air, and I tell you, last year, air was not on my list of self-nurturing variables, but since the last 12 months, we now know how important air is, and who would have thought we'd be so concerned with that? You get on the public transport here in Sydney and it says wearing masks is now mandatory everywhere you go. So it's our concept of air has really radically changed, but it's an important one. Our relationships are important in this sense of well-being from our own point of view. So all of these factors go into how an individual nurtures themselves. So you can see there's a lot of variables there. If we go to the next slide, you can see also that the organizational offers some nurturing as well. And these are things around job challenges. Are you doing something that challenges you? Is your job stimulating enough? Now, ironically, some environments are over-challenged at the moment, and they're overstimulated, and there's too much challenge. And I see this as well, where people are too stressed. They're too overworked. They perhaps don't have enough staff. And then this counteracts having a challenging job and can lead to burnout. It's not positive challenge, it becomes a negative challenge. So that's something that has to be monitored in an organization. Sufficient recognition is also something that comes from the organization. And this is all about appropriate, timely, accurate communication between the organization and the employee. And this is such a big area. I'll touch on it a little bit in a couple of slides in the future, but financial reward is a factor, and that has to be dealt with in a fair, equitable way. Resource support is also important. Do the teams have the tools to do what you are asking them, the tools to do what they need to do? So these are some examples of nurturing that come from the organization. So when you look at well-being in terms of creating an environment that's nourishing, you need to look at the organizational factors and the self factors. Okay, let's move to the next slide. I said the second characteristic was authentic communication. And authentic communication, I've got 3 areas for you to think about. First of all, passion is how much excitement you have. Without passion, the organization operates in zombie mode, and you don't have the striving to learn or wanting to stimulate others, or there's a lack of energy. So passion is an important component of communication. Courage is also really important. If an organization cultivates an open, honest, and frank environment in a healthy way, it is positioned to tap into the infinite possibilities within every single staff member. So this courage to speak in an organization is very, very important, and one that is a lot of times either taken for granted or not encouraged. And so you have to think carefully, how do you encourage and tell people to come forward with what they're thinking? And the last one to think about is insight. And this really has to do with analysis. What are you learning in the organization from the mistakes you make, from the direction you're taking, from the path? And how can you share these insights and learnings with others so you can keep moving forward towards your quest, all right? So the next slide, these are just a few tips that I'll put in here as far as things I've learned about what staff want. And this comes from me talking to staff and finding out what is on their mind. So first and foremost, staff want to be thanked. And I know it seems like such an obvious thing to say, but it's so overlooked in many, many organizations, and it's so valuable for people. So they want to be thanked. Often I will hear staff say, oh, the doctors thank my manager, but they don't thank me. So you need to think carefully about how staff are being thanked and who's being thanked. And it's not just a meaningless thank you, but it's a targeted thank you for something that's well done and it's appropriate to the person and it is really relevant to them. So that's a critical part. Staff also want to be kept in the loop. They want to feel like an insider. There's nothing worse than having staff find out what's going on from a patient. or from an outside source where they didn't know what was happening in the clinic or the organization. So staff want to be kept in the loop. They want to be involved. And this is about engaging them and including them in what's going on, keeping them up to date. And staff also want to have a say, or they want at least to have a chance to be given a say in what's going on, and knowing that they have a voice in the organization. And last, I want you to think about staff wanted to be treated equally without favoritism. And by this, I mean no preferential treatment, so that rules apply equally to people and that they're visible to people. It's really important. If staff see one rule applied inequitably across the organization, it can be such a demotivator, and it can undo so much of the good that you do in the organization. And so those are some of the things that I see that staff want. All right. Next slide, we talk about the third element going into the energetic workplace. And this is creating an engagement, a sense of involvement. And really engagement is about involvement, involving the whole team in talking about the vision, about whether it's achievable, how it's going, are you on track with it? And this is an important conversation to do beyond once a year, and not leaving it relegated to your annual planning day and then you come back next year and you review it again. If you're going to make this a real thing, you need to involve staff in it, and involve employees also in talking about the possibilities. What are the possibilities that we can create to get people excited and energized? At the same time, what are their doubts and reservations? So you need a realistic balance between what may or may not work, and constantly asking for improvements. And employees will come up with lots of ideas about improvements if you give them the opportunity to do that. So it's also giving them the opportunity to engage. And interestingly, I ask people, what are the gifts they bring to the table? So start to find out what are their skills and assets, and really understanding what these are, not taking them for granted, listening to people. This is how you're going to engage with your employees. One of the questions that I really like to ask is, what will keep you present in the moment? And it's sort of an interesting question. I ask this and people go, well, I don't know what you mean by that question. And it's really asking them about engagement. And it's a question about focus. How am I going to keep your focus while you're here at work for this amount of time? What will keep you engaged? And you'll be surprised by the answers. The answers are enlightening. So another thing is, don't assume you always know what the answer is going to be, because staff will surprise you often enough. So if we can go to the next slide, and the thing also to remember here in terms of linking the individual with the organization's purpose is a way to get that engagement and that involvement. You need to find out what's the link between the practice vision and the individual purpose. So this entails asking people, what do they come to work for? And as you know, a lot of people come to work for money. There's a paycheck. Can't deny that. That's a really critical factor. But other people come for work for a sense of community. They want to belong to something. The aspect of teamwork and being part of something is really important to them. Others want to help. That sense of really helping others is paramount. And still others want to come to learn. They want to be stimulated. They want to be challenged. They want to learn new skills. So these are things that you need to find out. And knowing your people in this way will show you how to reward them. There's no point rewarding someone with flexibility and autonomy if really what they want to do is learn more skills. That's missing the mark. And so you need to match the motivation with the reward. And this only comes from knowing your people. Again, one size does not fit all. People are multi-motivated. So finding out their perspective is really, really important. You engage people by connecting with them and by connecting their individual purpose with the organizational purpose. So take time to find that connection. That's really also a fun thing to do. Now, next slide. I just put these in here today to talk about some things I've asked people about non-monetary motivators. And you can see the range of things that come out here, and they're so surprising and varied. So they're beyond just money. And you can do this exercise in your own organization and ask people, go through this with them and find out what is the reality of motivation. All right, next slide. I just want to start to wind this down now. Why? You have to ask yourself, why do you want to create an energetic workplace, or why you're following your aspirational goal? And here I'm looking at the organizational consequences of having more or less energy, of being burnt out or fired up at work. So it has an impact on patients, on team members, and on the wider community, and in all elements of communication, quality of care, and consistency. So those are some of the organizational consequences. So you have to ask yourself, is it worth it for me to put energy towards achieving this aspirational goal? And I would say the answer is yes. The impact, for example, of communication on patients is really critical, and as well as the quality of care and the consistency of messaging and communication. So going through each of these and working out why is this important, will just asking that question will give you some answers that point to how you should manage that. The next slide shows just briefly some of the consequences again of having more or less energy. And you can see these range on a continuum from showing a bit more passion to all the way up to contributing to effective policy implementation. So you need to think of energy as a continuum for this. And we're all on this continuum. Less energy in the worst case scenario, you're compromising patient relationships, you're getting more sick days. These kind of things can occur on this energy continuum. So our next slide then, the payoffs in summary is I urge you to attend to staff energy and engagement as carefully as your financial audits, your procedural checks, and your equipment monitoring. The payoffs include having healthier staff. And by that, I mean our self-nurturing and our organizational nurturing elements are taken care of. Recognizing and being able to reward staff, reducing burnout, keeping staff, which is really important as well, and keeping them motivated while they are at work. All right, so I've got 2 more slides. The how is the just about the summary slide, really. So your role as a leader, first of all, is setting the vision. State your aspirational goals, work through those, fine-tune those, and as part of that, identify the targets and the goals that go hand in hand with that, and confront the challenges. Be realistic about this. So that's it, setting the vision. But don't set the vision aside, focus on the vision. Keep the vision at the forefront and come back to the why. Why are we doing it? Reduce distractions. I know we are all guilty of this. You have your planning day, you focus on the vision, you get back to work, and then you're down to the day-to-day operational. You've got patients coming through the door and you are running fast, and it's often hard. Oh yeah, that was our vision. We looked at that 2 weeks ago. I forgot all about it. Okay, so that's the challenge, is to focus on the vision. And then the next one is live the vision. Step into that energy that you've created with the vision. Remind people of it, commit to the vision, reward people based on that vision. That is going to be gold for you as developing a successful practice. And final slide here is about just my final thoughts. I heard this recently from a wonderful TED presentation from Dr. Mary O'Connor talking. If you get a chance to listen to it, she's terrific. You may have seen this before, but taking the I out of illness and adding we, you end up with wellness. And that's really what I've been trying to talk about today, is about organizational nurturing, about wellness, about well-being, about your own health as an organization. And I've given you some thoughts about it. So that's my thought for today. The next slide, I'm going to segue into an introduction of Anna Maria and PracticeHub. What I love about PracticeHub is it gives you a way to help with the doing of a lot of the things I've been talking about. It's a tool to help you manage. And by saving you time, energy, and effort, it allows you to focus on the leading, on the building excitement and focus on this organizational nurturing. So over to Anna Maria, and I leave you. You too can create an energetic workplace. So thank you very much for listening, and I look forward to Anna Maria's thoughts.
Terrific. Thank you, Catherine. That was such good information and some really practical strategies for people to think about in terms of communications and leadership. So for my part of the presentation, I'm going to tie in the managing part. So Catherine talked a lot about the leadership part, and this is the managing, the doing part of it as well. So I'll just start by highlighting that what I'm going to walk through today is a very brief overview. It's not the entire platform by any means, but let's go through and look at some of the things that Catherine mentioned and where PracticeHub can assist with that. So the first thing that Catherine mentioned that I'll touch on is the example about the visions. So Catherine showed us some vision statements from different organisations, and it's really important, as Catherine said, thinking about what is the vision, but also documenting and sharing it. And PracticeHub allows you to do that. So let's go and have a look. In our organisation, I'm using the example that Catherine had of the Mayo Clinic. So we have their mission, but they also have their value statements as well. And these are things that you can incorporate in here. So people who are new to your practice, existing staff, that constantly reminding them of these are our values, this is our mission, this is the journey we're going on. So including those in there. So when you do have new staff, they can go in and they can see that, and you're setting the scene for them and making it clear. Other things that I think are quite nice to do is create a video. If you are the practice principal, the owner, or maybe the whole team, you can insert a little video, maybe welcoming people to the team, what's important, that sort of thing, and just reminds people and makes them feel part of that team as well. So really, these are able to follow on from that. What do I want to do? Why do I want to do it? And how am I going to do it? So the next thing I think that comes out of that is sort of implementing these things. And so things like policies and procedures around things like code of conduct. So just sort of having a look, because that's the next sort of thing that comes out of this. So again, we've seen the mission, we've seen our values. What's our policy? So how do we actually enact those things? How do we put them into practice? And so having things like your code of conduct is really useful. So again, it's out there, people can see it. We're going to behave in accordance with acceptable professional standards. We're going to work within our scope of responsibilities. We're going to maintain our knowledge and skills. And of course, in healthcare, very importantly, we're going to comply with privacy and confidentiality requirements. And we're going to follow the practices, policies and procedures as well. So these are all things that tie back to helping to focus on the quest that the practice is going on. And there's other policies as well that I think are really useful in that regard, which would be things like, you've got ethical dilemmas, you've got things like open disclosure as well. So again, promoting that sort of authentic communication in there as well. So the other thing that Catherine talked about was those three key areas around the wellbeing, authentic communication and engagement. So thinking about organisational nurturing, one of the things I think we talked about was challenges. People want challenges, and ways in which I guess you can implement that and put that in practice is to have things like training plans. People like the idea of having professional development plans. So recording what they've done, making plans for what you're going to do in the future, and how these things in turn relate back to that quest where your practice is going, where your organisation wants to be. And again, documenting these things, having them really visible makes it much more powerful as well. The other thing from the organisational nurturing, we talked about recognition and reward. And I think one of the ways you can do this, again, it's a communication function, but, using a message board. And I know A lot of organisations nowadays have a lot of casual and part-time staff. And one of the challenges is always making sure people are kept up to date, that they don't feel left out. Again, that comment about, people want to be kept in the loop. And I think this is an important way of doing that. But, from the perspective of recognition, sort of having a process where you communicate that, we've got a process to nominate good people, and that we also have things like a compliments register and a quality improvement register as well. So let me just show you those sorts of things. So we've got our compliments register, again, encouraging that sense of recognition as well. So, and they can be simple things, or they can be more complicated things. People have really gone out of their way, but even simple things can be recorded. And I think it's important because, again, it sets that tone for the organisation. The other things to think about, I was going to show you also our quality improvement register. And again, I suspect most of you are doing lots of continuous quality improvement activities, but the challenge is remembering them and documenting them. And I think that it's important to do that and make that available to everyone, because then it allows people to see that. And sometimes reading these triggers other ideas. Again, so you're encouraging that engagement. It's like, these are the things we've been doing. If you've got ideas, you can show those to us as well. And the other thing we talked about, or Catherine talked about, resource support. Again, I find that things like PracticeHub are a great way to have everything in one place. There's no mystery about where do we find this information, how do we access things. It's all in one place. As a manager, it's really valuable because you can see what things you need to be doing, and you can see what things your team need to be doing. So it's very important that you've got that a resource to support your team, to make them more efficient and more effective in the roles that they have as well. All right, so for a little change of pace, the other thing that we talked about is this authentic communication. And what do staff want? So again, Catherine highlighted, they want to be treated equally, they want to be thanked, kept in the loop, be involved, have a say, all those sorts of things. So I think looking at this first one around being treated equally. So this is my normal user in the practice. They can see things that they're responsible for. They can see the communications, what's going on, so they feel they're sort of kept in that loop. The other thing that they can also do is that they can see things that have changed. So very important to be able to see policies and procedures that have changed. And you as the manager and owner, you also need to be able to know when people have reviewed that information, when they've acknowledged it, and you can see that as well. All right, so for example, I've recently updated the social media policy. Again, this is terrific for some of those possibly hot button issues, but you can see we've got our policy, the why we do what we do, which will tie back to our mission and our values. And code of conduct. And then we can see the procedure, the how we do these things, how they're implemented. So, the practice may observe the content, what's prohibited, what can't be published, that it's important to show respect. And the other thing, of course, that's really important is in terms of being able to link to third-party information. So things that are also relevant that tie back to this as well, making that external information really simple as well to access. The other things that I think are great ways for people to be involved, have their say, is through things like the ability to contribute their suggestions. So I feel like gone are the days of things like, post-it notes, or I really must remember to tell so-and-so that I've had this idea, and then people forget. So this is a way of doing it all in one place. So, something that's quite topical has been, particularly since the release of the new edition of the GP standards, but I think relevant to a lot of organisations, is things like ethical dilemmas. So here we can see, what are our guidelines in our practice? What are the other resources? And importantly, if I was looking at this, I might be a staff member who has a question about this, is there something I need to add to this? And I might say, what about Christmas gifts? Do we have to refuse them? Are our older patients going to be upset? And as a normal member of the practice team, I can send that off to the manager, who can review that and go, okay, that's a good point. We might update this policy to say things like, fruitcake and chocolate are still okay. We don't need to refuse those sorts of gifts. Other things that you can look at doing to give that sense of communication, keeping people in the loop, would be things like sharing minutes of your practice meetings. So once again, that idea that, not everyone can get to every meeting, but, here's the standard items we have on our agenda at every meeting. And you know what? You weren't able to come to the February meeting, but here are the minutes. And so people can easily access that information. So they've got that ability to be kept in the loop, to feel that can have their say as well. And again, that sort of covers that engagement component as well. So another last sort of area, that Catherine talked about is your role as the leader. And as your role as the leader, it's important that you're setting that vision, focusing on the vision and living the vision. And I think having something like this helps you to do that. And I think, there's 3 key things I talk about with PracticeHub, and it's the transparency, the consistency, and the control. And I think for the practice team, the transparency is really important. It's transparent information. There is that sense, we talked earlier about, people being treated equally. If your policies and procedures, the way you want things done, are documented, accessible, there is that sense of it's transparent, it's accessible, everybody knows what the expectations are, and it sets those standards as well. For sort of managers, I think that consistency is really valuable, because if you've documented how you want things to be done, you've got this process where you can say, I expect it to be done consistently because we've made it clear what our processes are. And for owners and principals, I think the control aspect is really valuable, because you've set your quest, you've set your vision, and this is your way of being able to maintain that control, that what you have decided or what you want to pursue is how things are going to be done in this process. So I think that, something as, you can spend a lot of time sort of talking and doing, sort of finding ways to do this, your managing of your leadership quest, but this is a very efficient and effective way of doing it that really focuses on encouraging things like that engagement and the organisational nurturing. Again, as I said at the beginning, this is a small part of the platform that I've showed you today. There are many more components, but we'll tell you more about how you can find out more about that. If I hand back over to Persephone, I believe.
Fantastic. Well, thank you everyone so much for joining us today. We really appreciate, you taking time out of your very, very busy schedule. A lot of the comments that we've had come through on the chat were really just thanking Catherine for her very insightful talk, and just about how you're all going to actually apply this, not just to your work life, but also to your personal life in terms of, getting that holistic wellness that everyone's so keen on achieving. So thank you so much to Catherine. We really appreciate you being here. That was great. And thank you so much to Anna Maria for kind of showing us how you can put all of this into practice on a daily basis in your organization as well. So if we go to the next slide, that'll just tell us our next steps. So if you are already a PracticeHub client, please contact our support team to find out how PracticeHub's functions can actually support you in, executing these communication and leadership strategies in your day-to-day work life. If you're not a PracticeHub client, please visit our website to find out more about the benefits and features of PracticeHub, or contact our sales team to book a demo or book one yourself online. We've got our phone number and also our email address and the website details listed below for you to actually go onto those things and contact us via those channels. If we go to the next slide, just a couple of things before we finish up. There is a feedback survey at the end of this webinar. If you could please take the time to fill it out, that'd be really helpful. We do actually read through all of the comments and all of the suggestions. So if there's a topic that you would like us to cover, we'd be more than happy to have a look at that and include that in our webinar program. A webinar recording will be emailed to all of you early next week. So that will be coming. So watch your inbox for that. And we also have a series of webinars coming up, which we're very excited about. So watch our website for that, and more information will follow definitely in your emails. If you have any questions, please let us know. You can email us at info@practicehub.com.au. Thank you so much for your time today. We really appreciate it.